Today, we'll discuss the topic of beta blocker toxicity. Beta blockers are commonly used medications for treating conditions like hypertension, arrhythmias, and angina. However, overdose or toxicity can lead to significant clinical challenges, including cardiovascular instability and life-threatening symptoms. We'll go over the mechanism of toxicity, the clinical presentation, and treatment strategies. Let's begin by understanding the mechanism of action of beta blockers and how toxicity occurs. Beta adrenergic receptors are G protein coupled receptors found throughout the body, particularly in the heart, lungs, and vascular smooth muscle. There are two main subtypes. Beta 1 receptors are primarily located in the heart, affecting heart rate, contractility, and conduction. Beta 2 receptors are found in the lungs and vasculature, causing bronchodilation and vasodilation. Beta blockers inhibit these receptors, thereby blocking catecholamine, such as epinephrine and norepinephrine, effects on the sympathetic nervous system. This results in decreased heart rate, decreased myocardial contractility, decreased conduction velocity. In toxicity, excessive blockade of beta adrenergic receptors can occur, leading to profound bradycardia, hypotension, and in severe cases, cardiogenic shock. It's important to note that beta blockers differ in terms of lipophilicity and receptor selectivity. Lipophilic beta blockers like propranolol can cross the blood-brain barrier, causing central nervous system symptoms like seizures. Some beta blockers have membrane stabilizing properties, which can result in QRS widening and ventricular arrhythmias. The clinical symptoms of toxicity. Now, let's discuss the symptoms you might encounter in a patient with beta blocker overdose. Cardiovascular symptoms. Bradycardia is the hallmark of beta blocker toxicity due to suppression of the SA and AV nodes. Hypotension results from reduced cardiac output and peripheral vasodilation. Conduction abnormalities such as AV blocks are common, and in severe cases, cardiogenic shock can occur due to a combination of poor cardiac output and decreased systemic vascular resistance. Central nervous system. Symptoms. Patients may present with altered mental status, confusion, or coma, especially with lipophilic beta blockers like propranolol. Seizures can occur due to the membrane stabilizing effects, leading to sodium channel blockade in the brain. Pulmonary symptoms. Bronchospasm may occur, particularly in patients with a history of asthma or COPD due to beta 2 blockade. Metabolic symptoms. Hypoglycemia can be seen, particularly in pediatric patients, due to decreased glycogenolysis and gluconeogenesis. Recognizing these symptoms promptly is crucial because beta blocker toxicity can progress quickly and requires aggressive management. Treatment and management. Let's move on to the treatment of beta blocker toxicity. The main goal is to support cardiovascular function while enhancing elimination of the beta blocker. Here's a structured approach. Initial stabilization. Airway, breathing, and circulation, ABCs, should be the first priority. Secure the airway in patients with altered mental status or seizures. Administer IV fluids for hypotension, though these may be insufficient without further intervention. Regarding pharmacological interventions, atropine. It is used as a first-line agent to treat bradycardia. However, it may not be effective in severe cases. Glucagon. This is a cornerstone of therapy in beta blocker toxicity. Glucagon increases intracellular cyclic AMP, bypassing beta receptor pathways to increase heart rate and contractility. Initial dose is 5 to 10 milligrams intravenous, followed by an infusion if effective. High-dose insulin euglycemia therapy. This is an important adjunct therapy, particularly in refractory cases. It increases myocardial glucose uptake and has inotropic effects. Administer 1 unit per kilogram intravenous bolus of regular insulin, followed by a continuous infusion with glucose supplementation to maintain blood sugar levels. Calcium salts, such as calcium gluconate or calcium chloride. These can help in stabilizing cardiac contractility and improving blood pressure. Calcium is especially useful in patients with concomitant calcium channel blocker toxicity. Vasopressors like epinephrine or norepinephrine. These are used to maintain blood pressure when unresponsive to other therapies. Lipid emulsion therapy. Intravenous lipid emulsion may be considered in cases of severe refractory beta blocker toxicity, especially with lipophilic agents. It acts as a lipid sink to sequester lipophilic drugs away from tissue. Decontamination and enhanced elimination. Activated charcoal can be considered if the patient presents within 1 to 2 hours of ingestion and has a protected airway. Hemodialysis may be effective for water-soluble beta blockers like atenolol, though it is less effective for more lipophilic agents. Advanced therapies. In cases where medical management fails, mechanical circulatory support like extracorporeal membrane oxygenation, ECMO, may be life-saving in patients with severe cardiogenic shock. In summary, beta blocker toxicity can present with a range of symptoms, from mild bradycardia to life-threatening cardiogenic shock. Recognizing the signs early and implementing aggressive pharmacologic intervention, including glucagon, high-dose insulin therapy, and vasopressors, is essential for a positive outcome. Remember that supportive care, decontamination, and advanced therapies like ECMO play a critical role in the comprehensive management of these patients. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge to go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.